Good afternoon. Today is Tuesday, October 20th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today are Anna Ritz, Immunization Coordinator, and Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department. Our first order of business today is for me to get a flu shot. Anna coordinates the immunization clinics for the Health Department, and she's here to give me my flu shot this afternoon. Anna?
I have your roll up your sleeve. Perfect. Nice and relax. All done.
That's it?
That's it.
Anna.
All right. Getting a flu shot is more important than ever this year. It's simple and convenient to get one. The health department provides flu shots by appointment on Mondays, Wednesdays, and Fridays. And flu shots are also available at your local pharmacies and from healthcare providers. It's best to get one early in the season before influenza becomes widespread in our county. The vaccine helps protect you and your family from getting influenza and can make symptoms milder if you do get the flu. The more people who are vaccinated, the better protected our community is, and the less burden it is on our healthcare system as we face the coronavirus this winter.
Thank you, Anna. That was painless. The CDC recommends that everyone 6 months and older get a flu shot. For more information or to make an appointment with the health department, please call 315-349-3547 on weekdays. Halloween is just around the corner, and I wanted to take a minute to mention some suggestions for celebrating Halloween. Many of the traditional Halloween activities that people participate in, such as door-to-door trick-or-treating and indoor costume parties, are considered high risk, meaning that they could easily spread the virus and lead to an increase in positive COVID-19 cases in our communities. There are many traditional Halloween activities that have a lower risk of spreading infections and that we can still enjoy with family and friends. Keep in mind that gatherings of 50 people or more are still prohibited in New York State, and some examples are to carve or decorate pumpkins with members of your household or with neighbors and friends at a safe distance outside, to have an outdoor Halloween-themed scavenger hunt, or to have a Halloween movie night with members of your household. If you still want to trick or treat, do it from a distance. Set out individually wrapped goodie bags at the edge of the driveway or yard for children to grab and go. Most importantly, if you're feeling sick or are under quarantine orders, please stay home and don't host or participate in Halloween activities. And now, Diane will report on the health department's monitoring programs and testing over the past week.
Thank you, Mr. Chairman. The COVID-19 virus is still active in our community. We lost the mouse. To follow up on the Chairman's suggestions about Halloween, anyone who has tested positive for COVID-19 or is waiting for test results or who has symptoms of the virus or who may have been exposed to somebody that had the virus in the last 14 days should stay home and not participate in in-person celebrations. People who are at an increased risk of severe illness from coronavirus due to age or other chronic condition should follow the same guidelines diligently. Over the past 2 weeks, we've seen an increasing trend of small clusters of family or household groups becoming infected with the virus. We are also seeing the virus spread in areas of the county that don't have a concentrated college population. Residents in every corner of Oswego County should be diligently practicing preventive measures, including frequent hand washing, face masking, and social distancing. These measures will also help prevent infections from seasonal influenza and other seasonal viruses. For this week's testing, our 7-day rolling average of people who were positive for COVID in Oswego County has improved from 1% to 0.4%. As of today, we've had 57,800 tests performed. We have 737 positive test results have come back. We have 38 active cases of COVID. We have 695 residents that have been released from isolation. We have 4 deaths related to COVID. We've received 56,898 negative test results back, and we have 165 residents in mandatory isolation or quarantine. Our rate of infection for antibody testing continues to hold steady at 2.4%. We've had 86 positive antibody test results in the county with 3,426 negative test results. A total of 3,512 antibody test results have been reported to the county health department. We continue to staff our COVID-19 hotline. Anyone with questions can call 315-349-3330 Monday through Friday between 8:30 a.m. and 4 p.m.
Thank you, Diane. The Health Department and Upstate University Hospital will offer drive-through COVID-19 testing Monday, October 26th from 3 to 7 p.m. at Cayuga Community College in Fulton. Appointments are required. The easiest ways to make an appointment are to email to covid/testing@upstate.edu and include name, date of birth, and phone number, or request through Upstate's My Chart if you have an activated account, or call 315-464-2778 and choose option 0. The tests are available to anyone. You don't need to have symptoms to be tested. There are more details about test sites on the Health Department's website at health.oswegocounty.com. We're all tired of this virus and the impact it is having on our daily lives, but we need to stay on top of things. We've lost lives in our own county, and others have been seriously ill due to COVID. Please stay home if you're sick. Please keep your children home from school or daycare if they are sick. If you have COVID symptoms, contact your primary care doctor and arrange to be tested. We can't emphasize this enough. Thank you to our residents and businesses who are doing their best to prevent the disease from spreading. Be safe and be well. You are making a difference.